Hi, this is Mark Packer talking to you from the SIGHTLINE meeting at ASCRS in Washington, D.C. in this year, 2026, which has been a very interesting year so far. And of course, you all know the old Chinese proverb, may you live in interesting times, supposed to be kind of a curse, but perhaps not. In times like these, I think it's really important to get back to fundamentals, what really matters, what's really important. And as an eye surgeon, of course, I think vision is really important, not just our own basic physiologic vision, but also our ability to have vision about our futures. But I wanted to talk a little bit about cataract surgery, which is kind of my thing, and especially because I had cataract surgery not that long ago. I may look younger than I appear, but cataract surgery is unbelievable, completely remarkable, miraculous. I have to just say, I have never had vision as good as I have now after my cataract surgery. And part of that is because I'm a little bit nearsighted, or I used to be. And so when I had my first eye done, I thought, oh, well, let's match the fellow eye, make it a little bit nearsighted. And that was fine. But when it came time to do my second eye, I thought, you know what, let's go for distance. And so now I actually ended up having monovision, which surprisingly is something I never really did that much for patients. I would do monovision for patients if they had a history of monovision in contact lenses or seemed really interested in it, but that's not a lot of people. Mostly, I really like the idea of multifocal IOLs. I mean, provide distance, intermediate, and near for everybody all the time. That was kind of my approach to cataract surgery. But now, having monovision myself, I'm like, hey, this is pretty good. So I've learned a couple of things. One is, always know there's a possibility that you're wrong. I remember somebody said, when I was in medical school, half of what we're going to teach you is wrong. The problem is we just don't know which half. So be humble. Remember, you could be wrong. The other thing I learned is, hey, this is an amazing procedure with fabulous outcomes almost all the time. As a surgeon, I think I've always been more focused on safety because that's so important. And as a surgeon, I know things could always go wrong. And in my current work as a medical monitor for multiple clinical trials in ophthalmic surgery and drugs and devices, I'm always focused on safety because for subjects in a clinical trial, you want to make sure that they're not going to get into trouble. That's number one. So I think I was so focused on that, I never really emphasized the benefit. And now I'm experiencing the benefit of cataract surgery. I'm saying to myself, wow, I undersold this procedure my whole career. And maybe that's a good thing because we're kind of taught undersell and overdeliver, which I think is good. But at the same time, remember why we're doing this. We're doing it for the incredible benefit that it provides. And in the bigger picture, in life, I think that's really important. Remember, especially in times like these of great uncertainty in the world, remember why you're here. What did you come here to do? What's really important to you? What makes your life meaningful? What gives it purpose? That's where it's really important to focus. Thank you so much.